Hello everybody, this is Dr. Budha Ram. Today we will gonna discuss NEET 2024 paper evening session. So I wish all the best to all of you. I hope सबका पेपर अच्छा होगा जिन्होंने पढ़ाई कर रखी है. Obviously जिन्होंने नहीं कर रखी होगी they will targeting NEET 2025. The paper level was very good, moderately easy was paper, easy to moderate level was there. The PYQs were, lot of PYQs were there, but this time the examiner did was a very good thing. He gave a clear cut, loud and clear message that you have to read the textbook at least once, but not the whole textbook, just the topics that were repeatedly asked in these exams, INI, CET, NEET, FMG. सो मैसेज एकदम लाउड एंड क्लियर है कि आपको एक आध बार टेक्स्ट बुक पढ़नी ही पड़ेगी और उन टॉपिक्स की एटलीस्ट जो इन एग्जाम्स में पूछे जा चुके हैं. बिकॉज द सेकेंड सेशन वाज एक्सपीरियंस ऑफ स्टूडेंट वाज दैट दे हैव हियर्ड द टॉपिक बट द ऑप्शन वाज लिटिल कन्फ्यूजिंग. दे हैवंट रेड द ऑप्शंस बिकॉज द कोचिंग पीपल आर टीचिंग very crisp and concise, but the thing is that the thing was missing in the exam that the coaching people taught us was not in the options. We were searching for the option and that option was not in the exam. So let's start with radiology. Question number 1. Question number 1 says a 6-year-old patient presented with seizure controlled with midazolam, lumbar puncture done and reveals no pathology. So MRI was given and what to do? Confirm the pathology. So option number CV not in CSF. CV not in CSF will not help. MR spectroscopy is answer. And B scan of eye or PET scan will not help the determine. The image was of ring enhancing lesion, which is probably of abscess. So the answer is MR spectroscopy. This is the picture of MR spectroscopy. How MR spectroscopy looks. This is MR spectroscopy. MR spectroscopy is done to see the peak of latent metabolites. So we see that which metabolites, like in TB, lipid peak will be seen. Question number 2. A newborn with respiratory distress presented in OPD. Auscultation, gurgling sound was heard. Gurgling sound in chest and muffled heart sound shifted to the right side was heard, and asked what is the most common side of pathology. So the diagnosis is here is congenital diaphragmatic hernia. Congenital diaphragmatic hernia, most common variety is Bogdaleg. Bogdaleg is in BPL mnemonic. You have read posterior lateral. So left posterior lateral is the answer. The diagnosis is congenital diaphragmatic hernia, most common. Patient presented with question number 3. Patient presented with mediastinal mass. CT chest is given, which is correct. The question was quite long with some more history, but the picture was this. Not exactly same, but the picture has mentioned over a lesion minus 60 Hounsfield unit. So minus 60 Hounsfield unit is fate, or the calcification was clearly visible on peripheries. So it is the picture was of mediastinal teratoma. Mediastinal mass with fate and calcification is the answer. The mediastinal teratoma was not in the option. The mediastinal teratoma was defined in the options, one of the options. Identify the labeling on CT scan. The CT was of chest. Transverse section of the CT chest given and labeled the 4 structures. The structure B is trachea, A is aorta, C is superior vena cava, or D is esophagus. So the option mentioning A aorta, B trachea, C SVC and D esophagus is correct. A 10-year-old child presented with history of RTA Injury to knee on marked structure on X-ray. What is the diagnosis? The structure marked here. So the tibial tuberocity. The epiphysis was not closed in this X-ray. They are closed, but in exam the X-ray was given of unfused epiphysis of child. So answer is tibial tuberosity fracture. This is known as osgood schatter disease, but the osgood schatter disease was not in option. Option was tibial tuberosity fracture. Question number 6. Patient presented with difficulty in swelling and investigation is done. The name of investigation was not given, but a very thin white line is shown here. A very thin white line, not that much thick. In exam X-ray, a very thin line was seen in the. This is barium swallow. In exam, 2 questions were in which investigation options were same. So in this question जो line होती है कि which is best possible answer, तो ये best possible है क्योंकि fluoroscopy is a wide term. Fluoroscopy is a video X-ray that can be done in many of them. ERCP में भी fluoroscopy होता है, इवन हिस्ट्रोसाल्पिंगोग्राफी होती है, उसमें भी फ्लोरोस्कोपी होता है. तो फ्लोरोस्कोपी इज नॉट आंसर. आंसर इज बेरियम स्वैलो विच इज मोर स्पेसिफिक. ये मोर स्पेसिफिक है इसलिए ये आंसर है. इन्वेस्टिगेशन ऑफ एल्कली इंजेक्शन और एसिड इंजेक्शन का भी ऐसा ही हो सकता है, लेकिन वी कैन नॉट डिफरेंशिएट इधर एल्कली और एसिड और सम अदर पैथोलॉजी. सो दिस इज नॉट द करेक्ट आंसर. Question number 7. A 14-year-old patient presented with complaint of visual field defect, bilateral hemianopia, and MRI was done. As shown below, on excision lesion has motor oil consistency and some other features were given. So this is CCC, child craniopharyngioma cystic lesion. So this is motor oil consistency is the thing that we look for in exam always. So this is craniopharyngioma. Question number 8. A patient presented with fever, headache, MRI done as shown. The diagnosis. Patient fever और headache के साथ आया है, MRI के अंदर ring enhancing lesion और suppression नहीं हो रहा है, तो this is brain abscess. Toxoplasmosis shows cerebral calcification, not ring enhancing lesion. और glioma, tuberculoma are not question. Question number 9. A patient presented with chest pain on examination. BP was 130/90, reps rate 20 per minute, pulse rate 100 BPM. On echocardiography, right atrium was collapsed. Is seen on radiograph. Seen and radiograph is shown. Radiograph के अंदर there is no battering pulmonary edema. The edema is in whole lung field. So this is sorry. This is not the edema component. This is the cardiomegaly. The CT ratio is increased. So this is of cardiac tamponade. Cardiac tamponade का management, drainage of pericardium, fluid by pericardiocentasis, steroid का कोई रोल नहीं है, diuretics will not decrease the pericardial effusion fluid. The question number 10. A patient presented with chest pain, respiratory distress with history of hypertension, vitals stable and having following pathology. This pathology image was shown in exam. What is the preferred management? This is Stanford B. तो Stanford B का management होता है control the BP and give beta blockers. Surgical repair, diaphragmatic graft repair, endovascular repair. This will be seen in type 1 Stanford classification. Question number 10. Patient of chronic abdominal pain, X-ray is given. In X-ray we can clearly see the stones in pancreatic distribution. So this is chronic pancreatitis with calculi. Question number 12. A patient presented with headache, diagnosis. The image was given is there is a brainstem herniation is seen. So this is Arnold chiari 1 malformation. Corpus callosum and agenesis, this will be agenesis, and vein of Galen malformation will be seen a group of veins here dilated. So this is not vein of Galen malformation. Dandy-Walker malformation dilation will be seen here. So this is not Dandy-Walker malformation. The chiari 1 is associated with syringomyelia. Question number 13. A 25-year-old patient With acute pain, abdomen and elevated serum lipase, patient was stabilized after 3 days and now complained of respiratory distress. Chest X-ray done. This patient I was talking. There is no between pulmonary edema. There is whole lung filled edema is seen. So this is non-cardiogenic pulmonary edema. This is not miliary TB. This is not pulmonary thromboembolism. There was a question with some history, and in left side there was a homogeneous cyst was seen adjacent to kidney. Large homogeneous cyst. The consistency was same of this. So this is not polycystic kidney disease. In polycystic cyst, more than 2 will be there. Not PUG obstruction because there was no connection between. This is renal cyst. Question number 5. Correct statement regarding foreign body given in X-ray. X-ray के अंदर foreign body is seen in esophagus. The trachea is here. Foreign body in esophagus. So right main bronchus is one of the constriction site. No, the left is a constriction site. Most common site of infection is craniopharyngitis. Yes, at C6 level, narrowest part of the GIT. This is most common site of infection. Can cause mediastinal. Yes, no. This cannot cause mediastinitis. Question number 6. A lesion in right agnatha with incomplete septation and cogwheel pattern. The word is cogwheel pattern is mentioned. This is buzzword. We want to hear this. This was image this incomplete septa. This is hydrosalpinx. Question number 17. Adult female patient presented with pelvic pain during menstruation. MRI of endometrioma is explained. That no image was given. This is explained that T1 hyperintense mass in right extensor with non-suppressed on fat image. T2 dark shadow sign is seen. All things were given. So this is endometrioma. Question number 18. Patient presented with pulsatile tinnitus, hearing loss. On clinical examination there is mass seen on promontory through TM. HRCT given. TM में मास था और पल्सटाइल टिनाइटिस था. तो जब मास दिखता है promontory पे TM में, तो this is globus tympanicum. This is globus tympanicum. But some people are saying this was a globus jugular. So in jugular mass is seen here. So which were image in exam is answer, but I think it is globus tympanicum. This is very tough question per se, as per se radiology. So you will learn when you will do your radiology residency, you will find it. अभी समझ में नहीं आ रहा है, कोई बात नहीं, let's leave it. Question number 19. An elderly patient presented with confused state. Patient was on antihypertensive and aspirin. Had trivial trauma 3 weeks ago. And NCCT is done, so it cannot be a chronic SAS. SAS will be seen here. This is chronic SDS. Lenticular sac opacity. This cannot be EDH. EDH will look like idli or lens sac. This is chronic SDS. Question number 20. What condition does MRCP indicates? This was MRCP. This is of choledochal cyst. Someone described this like some 2 balls is going down. Very vaguely described, but this is choledochal cyst. Question number 21. This will of orthopedics, but we can discuss in radiology. Adult patient with backache diagnosis. So we can see L5 S1 के level पे this gap S1 L5. So this is spondylolisthesis. This is not renal osteodystrophy. Spondylolisthesis. This is last question. Patient presented with fever, purulent, foul-smelling sputum along with breathlessness. X-ray was done. Diagnosis. So you can see a clear cavity with air fluid level. This is lung abscess. Pneumatocoel have a thin wall structure with air. इम्पाइमा में भी एयर, बुल्ला में भी एयर होगी, इसमें एयर नहीं होगी. सो दिस इज वन एब्सेस. थैंक यू गाइस. होप आपका पेपर अच्छा गया होगा. अगर आपको लगता है कि मैंने कुछ गलत है या कुछ ऑप्शन और ऐड कर सकते हैं, कुछ हिस्ट्री ऐड कर सकते हैं, तो फील फ्री टू कमेंट ऑन बिलो लिंक. अगेन बेस्ट ऑफ लक. थैंक यू.